Do you know that every 40 seconds, someone in the United States has a heart attack? That's more than 600,000 people every year. And while some heart attacks are obvious and cause chest pain, sweating, and nausea, others are more subtle and can go unnoticed. These are called silent heart attacks, and they can be just as dangerous as the ones that make you clutch your chest and call 911. In fact, according to a study by Harvard Medical School, about half of all heart attacks are silent, meaning they don't cause any symptoms or the symptoms are so mild that people ignore them. But ignoring a silent heart attack can have serious consequences, such as heart damage, increased risk of another heart attack, and even death. That's why it's very important to know the silent signs of a heart attack and seek medical attention as soon as possible. In this video, we will reveal 9 silent signs of a heart attack that are always ignored. So, without further ado, let's get started. Number 1. Unusual fatigue. One of the most common and overlooked signs of a silent heart attack is fatigue, or feeling tired all the time. This unusual fatigue can be a silent sign of an impending heart attack, especially in women. This isn't just your typical tiredness after a long day at work or a strenuous workout. This is a profound, unexplained fatigue that can last for days or even weeks. It can feel like you're suddenly running a marathon, even though you're just going about your daily routine. This happens because your heart is not pumping enough blood and oxygen to your body, and your muscles and organs are working harder to compensate. Although fatigue can also be caused by other factors, such as stress, lack of sleep, or depression, if you notice a sudden or persistent change in your energy level, especially if it's accompanied by other symptoms, don't brush it off as normal. It could be a sign that your heart is in trouble. Number 2. Nausea, heartburn, or stomach pain. Some people have these symptoms during a heart attack. They may even vomit. Women are more likely to report this type of symptom than men are. This is because a heart attack can cause digestive upset due to the fact that the heart and the stomach share a nerve pathway. When the heart is in distress, it can send signals to the stomach that can be interpreted as indigestion or stomach upset. These symptoms can also be caused by acid reflux, gastritis, ulcers, or food poisoning, but if they are severe, persistent, or accompanied by other symptoms, such as chest discomfort, shortness of breath, or sweating, they could be a sign of a heart attack, and you should not ignore them. Number 3. Neck, jaw, or back pain. Pain in your neck, jaw, or back can also be a sign of a silent heart attack, especially if it's unusual, sudden, or radiates from your chest. This is because the nerves that supply these areas are connected to the same ones that supply your heart, and when your heart is under stress, it can send pain signals to these areas. The pain can be mild or severe, and it can come and go or last for a long time. It can also be triggered by physical or emotional stress, or by eating or drinking. If you have neck, jaw, or back pain that doesn't go away or gets worse, or if you have other symptoms, such as shortness of breath, chest discomfort, or sweating, it could be a sign of a heart attack, and you should call your doctor or 911 right away. Number 4. Shortness of breath. Shortness of breath, also known as dyspnea, can also be a silent sign of a heart attack. This symptom can manifest as feeling winded, having trouble catching your breath, feeling like you can't get enough air, or even gasping for air. This can occur while doing something you used to do with ease, like climbing stairs or carrying groceries. Shortness of breath can be caused by a blockage in your coronary arteries, which supply blood to your heart, or by a reduced pumping function of your heart, which can lead to fluid buildup in your lungs. Either way, shortness of breath is a serious symptom that should not be ignored, as it can indicate a heart attack or heart failure. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Unexplained weakness. Feeling weak or having difficulty doing your normal activities can also be a sign of a silent heart attack, especially if it's new or worsens over time. This can happen because your heart is not pumping enough blood and oxygen to your muscles, and your body is trying to conserve energy. Weakness can also be caused by other factors, such as anemia, infection, or dehydration, but if you have unexplained weakness that lasts for more than a few days, or if you have other symptoms, such as chest discomfort, shortness of breath, or fatigue, it could be a sign of a heart attack, and you should see your doctor as soon as possible. Number 6. Anxiety or panic attack. Feeling anxious or having a panic attack can also be a sign of a silent heart attack, especially if you have no history of anxiety or panic disorder, or if your symptoms are different from your usual ones. This can happen because your body is sensing that something is wrong with your heart, and your nervous system is reacting with fear and stress. Number 7. Dizziness or lightheadedness. Dizziness or lightheadedness can occur when your heart is not pumping enough blood to your brain. It can make you feel like you're going to pass out. This is because the brain isn't getting the oxygen it needs to function properly, or because your heart rhythm is irregular or too fast or slow. Keep in mind here that dizziness or lightheadedness can also be caused by dehydration, low blood sugar, or medication side effects. But if you experience it along with other symptoms, it could be a sign of a heart attack, and you should seek medical help immediately. Number 8. Cold sweat. Breaking out in a cold sweat for no obvious reason is another sign of a silent heart attack that is often overlooked. This can happen when your body is trying to cool down and cope with the stress of a heart attack. It can also be caused by anxiety, fever, or menopause, but if you have a cold sweat that is not related to these factors, or if you have other symptoms such as chest discomfort, shortness of breath, or nausea, it could be a sign of a heart attack. Number 9. Swelling. Swelling, also known as edema, can be a silent sign of a heart attack. This can manifest as swelling in the feet, ankles, legs, or abdomen. This happens because when your heart is not pumping effectively, blood can back up in your veins, causing fluid to accumulate in your tissues. This is why you might notice that your shoes feel tight or your clothes feel snug around your waist or legs. It's important to note that while swelling can be a sign of a heart attack, it can also be a sign of other conditions like liver disease or kidney disease, so it's important to get checked out by a healthcare professional. So, these were some of the silent signs of a heart attack that are always ignored, but they are not the only ones. There may be other symptoms that are unique to you or that you may not notice or associate with a heart attack. That's why it's important to listen to your body and trust your instincts. If you feel that something is wrong, don't hesitate to call your doctor or 911. It could save your life. Now, we want to hear from you. Did you have some of these signs before? Was it actually a heart attack? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.